Dr. Jennifer V. Brown, your stroke specialist, and today we're going to discuss strengthening the tibialis anterior before we have the patients do ankle pumps, usually in supine, laying on their back, or sitting in a chair. We have to really think about what's causing the foot to drop down. Is it truly the weakness of the tibialis anterior, or is it a problem of the posterior calf muscles in that there's increased tone or spasticity? And so sometimes you have to address the posterior compartment muscles before you can get the tibialis anterior to work. Watch the video.
Now, sometimes the anterior tib cannot pull the foot up because of increased tone in the calf muscle. So you have to fatigue the calf muscle by actively contracting it. So we do contract, relax. We ask the person to push down into my hand. Push, push, point your toes down. Point your toes down. Push, 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 push. Hold it for 10 seconds. Push, 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 push. Relax. The cue can be, can you pull your foot up? Pull your foot up, pull your foot up, pull your foot up. Good. And if they can't pull their foot up, then I actively push the foot up. And then I can ask them to hold it there. Hold it, hold it, hold it, hold it. And then when they relax, the foot should drop down and in. So it's a good way of combining hold, relax, and contract, relax.
I like the combination of doing hold relax with contract relax. Again, contract relax fatigues the posterior compartment muscle, which may be masking the weakness of the tibialis anterior. And then we just do hold relax. Key thing is to support the leg and the foot in gravity minimized position. And you have to differentiate a couple of things. So you have to ask yourself these clinical questions. Is there adequate range of motion at the ankle joint? That's the first thing. If there's a limitation in the range of motion, is it because of the Achilles tendon is tight or is there contracture present? And last, you have to differentiate how much of the foot going down and in is a problem of the posterior tibialis muscle. And you just may have to activate and fatigue that muscle with a different position of resistance with your hand. Remember, I'm your trusted source for stroke neurorehabilitation. And don't forget your references, evidence-based practice. See you on the next video. Thank you.